So can we start it from the beginning?
Yes, I'll do that. Good afternoon, everybody, and welcome to the MIT World Peace University, the Faculty of Sustainability Studies, the School of Public Health. We are hosting this an important workshop on providing care for the elderly women in Vrindavan. And today we have speakers with us, Madam Winnie Singh and also Lieutenant General Bhupendra Singh. Both of them together, they're running two ashrams at Vrindavan, and most of you are familiar with the history of Vrindavan. And also they take care of the residential residents as well as the people who come and take the services. So almost about 300 women are benefiting from on a daily basis for the last almost a decade. So today, all of us, our collective experience is living with a pandemic. And one of the most challenging experiences is how to take care of the elderly. And we know that many of us are struggling with how to take care of our own elderly in our own homes. And COVID pandemic is in that way very personal for many of us. We ourselves got infected, our relatives got infected, our dear and loved ones got infected. But imagine that taking care of almost 300 women without not a single one is getting infected, touch wood, and thank God. So they'll be explaining about how they did it and what are the precautions they took. And also remember that the experience of running an NGO, I request the students to interact with them and ask questions to get what you want to know about it. And before I begin the session, I would like to show a brief video created by one of our common friends. Sorry.
Kunal.
Yeah, Kunal, he created many videos for us and for Vrindavan, and he's one of his latest creation is Life of the Indian Widows of Vrindavan, and on behalf of Maitri, he created it. This will give you a contextual understanding about Maitri and the widows who stay at the Maitri Gram. And without much ado, I just let me show the video. And welcome to all of you. And I'll formally introduce Winnie and General again. So let's see the video first, then we'll begin the formal session. Thank you.
Excuse me, so there is a background noise. I think somebody else's microphone is on in between. Because of that, the voice is not getting clear.
Good afternoon again, and I'm sorry there are some technical issues with our video. It is a short video on a day-to-day life of widows in Vrindavan and who are staying at Maitri Gram. So technically I don't know what happened. I'll try to figure out how to do it again while our presentation going on. And let me invite Winnie Singh and General Bhupendra Singh to make their presentation about Maitri and how Maitri began, the story behind the Maitri, and what they do on a day-to-day basis, and as an NGO, how you manage it, and what are the challenges you face, and also what are the day-to-day difficulties in managing and keeping them safe from the COVID pandemic. So these are some of the issues we would like to hear from you. And we know that there are two issues I just want to highlight. This is the year of elderly, and also this is we experienced the COVID pandemic. And in the pandemic time, one of the main important experiences is the most people affected and impacted by the pandemic is elderly population. So Winnie and Janal Singh, they have hands-on experience of taking care of them, and they'll be sharing their experience. And let me invite both of them to make their presentation. Then we'll take question answer. We'll have time to interact with them, and you can ask your questions about how they're managing the center. And let me invite Winnie and Janal to make their presentation. Thank you.
Thank you, Joe, very much.
Thank you, Joe.
I'm Winnie Singh, and this is my husband, General Bhupendra Singh. I think, Joe, probably there are a lot of
People who
have not muted their connections, and that's why a lot of static sound is there.
I'll take care of that.
Hello? Can you hear us? Okay. So I'm Winnie Singh.
I'm General Bhupendra. We are both co-founders of Maitri. To give a little background, I was there as the Director General in the Northeast, where we established in 2005 this NGO Maitri. And later, when I took retirement,
Joe, there's too much of static. There's too much of static. Is it that people have not muted or something? I can't hear you. You muted now. Now you are muted, so I don't know.
I'll do that, don't worry.
Okay. Okay, now you can.
sorry, I was just mentioning that before I retired in 2005, we established Maitri. And in 2006, we shifted to Delhi, where we started work with the migrants, and later we took on the cause for the elderly. This is where we came in close touch at the formation stages with Dr. Joe Thomas, who's also one of our directors. Maitri, we chose this as you can say, an accidental intervention by Lord Krishna, that we went to Vrindavan, where Winnie was the president of our Rotary, and there she got gravitated to this cause. She will explain later, or rather now, how we got into this.
So, Joe, I will, if it's okay, I'll make a presentation and, take it forward with that.
Please share your
I'm going to try and see that I can do that. How do you do this? How do I do this?
Try the share screen in the middle of that button, a green button.
When I do share, it gives me something else. It gives me a whiteboard.
Then you look for that. Yeah.
I'm coming to the files, but it doesn't give me my desktop somehow.
You send it to me, I can share it then.
All right, I'll do that. I will. I've sent it to you, Joe. I've sent it to you.
Email or WhatsApp?
Email. Did you get it? Right. Joe, are you able to see it? Can you see it? I can't hear you. I'm sorry for the delay. Joe, did you find it?
Yeah, I'm just showing it 1 minute.
Okay. So, as it says, I mean, caring for the elderly. And what we are talking today is that during COVID-19, how did we kind of take care of the all elderly women? Our youngest is 65 and our oldest is 107 years old. So how did we, I mean, what are the lessons we learned from that? Joe, next. So this is just the background of how Maitri came into being. I think we can skip that. I mean, it's our motto is identity, dignity, and respect. Maitri was founded on those three static. So Joe, sorry, there was a static, Joe. Hello, hello. So Maitri was founded on three principles, which is identity, dignity, and respect. So this project was chosen to basically make sure that these women who had lost their identity in migration and in getting to be homeless, they regain their identity, not just figuratively, but also literally, like their citizenship rights also were lost when they moved out from their homes. They were abandoned by their families. And because they were living as abandoned women and they would beg, so people would not give them any kind of respect and they had no dignity left for themselves at all. So that is where, when we stepped in and we decided to work with them, because at the last end of your life is the time when actually you should have uh, dignity and respect, and more so for a woman and more so for a mother, that she never has to put her hand out to anyone, for her food or for survival. So Joe, let's go forward. And these are our two ashrams, Vrindavan and Radhakund. So one of the programs that we have, Joe, let's just go with that, the previous one slide. Yeah. So one of the programs that we have, even before we started residential program, was that we used to give them a midday meal in those days, because our focus was that if a woman gets good nutrition, she would be able to, kind of take care of herself. She would not be eating out of garbage and she would not beg for people. In those days used to give them 10 paisa, 20 paisa. I'm talking of 2010, 11, which is not too long back. But, obviously that never got them enough food for themselves. So these are the pictures which are of the recent times when we have our ashram together. And one on your left where the paintings are there is the Vrindavan ashram, and the other one is the Radhakund ashram, where we have in Vrindavan we have 100 women, and in Radhakund also we have 100 women staying inside. And then we have another 150 who come every day to take the facilities, the of food and medicines, etc. Joe, the next one, please. So, how did we start working with this particular project during the COVID was that our first of all, our aim was that we have to protect these women. We have to ensure their health, and we have to ensure that they are really looked after well, mentally and emotionally. So our first thing that we did was that we actually put a lockdown in our ashrams even before the lockdown was announced by the Prime Minister. We could foresee what was going to happen. And with that, what happened was that obviously there were going to be no external visitors, because earlier we used to get a lot of people coming in. And the staff which would choose to stay indoors were the ones which were going to, kind of stay in. The rest of the staff were going to continue staying in their own homes, though we did not stop their salaries. Everyone got their salaries. And till date, a lot of them are still getting it. Some of them then chose to move on. And our staff was trained gradually, at this point of time, to work differently than what they were trained for earlier. Now they had to be more sensitive, because the women were scared suddenly. They did not know that what was happening. This was a very new subject. I mean, COVID-19, none of us knew about it, what it is. It's like, it sounded like the devil had come itself. So our instructions to our staff and all the caregivers were that they had to be very compassionate, very patient with the women, because the women initially were very reluctant, I would say, to be locked down. They were reluctant that they would not be allowed to go out. Though we did tell them that, this is not the time for them to leave. We had to keep explaining to them that it's not the time for them to leave the ashram, because maybe it is not going to be safe for them outside. Their health can be impacted, etc. And the women were then gradually prepared. And I think one thing that did help, we realized, was when the Prime Minister spoke, I think his language was pretty much talking to the people at the grassroots level. So they understood the language, and they understood that there was something which was very big and it could impact their health. And that was the reason that they had to stay indoors, and they had to be careful, and they had to, wash their hands and put a mask on. Initially, they were not wearing a mask in the ashram. We did not even ask them to do that, to be honest, because things were absolutely static at that time. There was nothing happening. There was no activity. And so the women kind of calmed down after the Prime Minister's speech. It took them like about 4 or 5 days. They kind of settled down thereafter. So, Joe, can we go on to the next one? As you see in these pictures, so initially what happened was that as soon as the lockdown was announced, we get food from Akshay Patra. It's one of the ISKCON organizations, which basically looks at giving food to children, and they look at it that nobody goes hungry, and nobody has to sleep hungry on a empty stomach. And but they were never looking at working with the widows. And we had requested them, when we started our program, and our program started with their support. But because of the lockdown, there were a lot of confusion, and they said that they would not be able to provide us cooked meals. And that was the time there was a panic amongst us, and we got rations. And the women, I'm very glad to say, took the ownership, and they said they would help out, and everyone would pool in together and make the effort and make food together over there. It would be like a community lunch. Joe, let's go forward. And we did not want to deprive them, obviously, of the milk that they had always been getting. So we had our, the milk obviously would be given to the ladies inside, but even the outside women, they were told that they had to come and wear a mask, and then they could take the milk. And all the women then, they gradually started wearing their masks, and they would keep a distance, and they would be distributed fruits, and whatever was happening was kind of, the rules were followed very diligently. Joe? See, this is like they took up the ownership of cleaning the ashram, because it was a very skeletal staff that we had in those days. And then we tried to engage them in various activities so that, they would be mentally also not fatigued out. So they would kind of participate in everything. They made the masks themselves. Some of the women said that we will sit together and make 5 masks for each woman. So we got them the cloth, and they made about 10 women sat down and made masks for everybody. Joe? So as I said, our priority was that the widow mother's nutrition and health was something that we could not have compromised on, and especially at such a time. I mean, even in the earlier days, it was our, sorry. It was a priority, but during this time, it became more of a focus, for the simple reason that if they would get good food, and they would get their milk and fruits, they obviously would be more energized. They would look forward to every day. We started getting them 2 fruits in a day. And we started another initiative that, we would get some extra milk and say, all right, let's make maybe some kheer today, apart from the milk that they would have on their own. And we requested Akshay Patra also that twice a week they could, make something special for them, which they would enjoy, like probably halwa or barfi, etc. And yoga became a very, very key activity at this point of time. So while earlier days, very few widows would engage in yoga, they preferred to go out and do bhajan, kirtan, etc. And there are bhajan ashrams over there, but they would not sit in the ashram itself and do it. But during this time, we found that all these activities came in, to bring them all together and bond together. So every day, all the women would get together, and at 6 o'clock sharp, they would be doing yoga. Joe, we've gone too forward. Yeah, I think we are right over here. We are right at this one. So they would be doing yoga, and they had a routine set for them. So, there were some women who wanted to walk. So we have a little green patch outside the ashram, in our own ashram. So they would walk over on that, on that grass, the dewy grass, for half an hour, 40 minutes. And the others would do yoga. And then they would have their breakfast, etc. And thereafter, they would sit down and, do meditation. And gradually they kind of got down to doing other things. So that's the time, fortunately, Mahabharat and Ramayana and all these things started. So TV became a big factor in their lives, which also helped them uh, staying busy and looking forward to something else. So we also got them immunity boosters. At this point of time, we got them vitamin C's, we got them Chavanprash, we got them Ashwagandha and Triphala, you name it, and we had it. And they're getting it till date, actually, to be honest. And then we have a lot of women who are chronic patients of diabetes and blood pressure, and they have heart issues. So we had to make a great effort to educate them and, kind of very firmly tell them that now they had to be very, very careful about their diet, because there was no medical help available outside, because no hospital would entertain anyone. Even if you were sick, they would say, sorry, we cannot take anybody. So actually, I'm glad to tell you that during the last year, we did not have to take even a single woman to a hospital, whereas earlier 10 to 15 every day from each ashram would set out for the hospital, and they had list of their kind of issues and problems. But in this time, none of them went there. And there was resistance, of course, but then they learned. And of course, we had to keep repeating to them that they had to follow the protocol of washing their hands before the food, after the food. If they sat down on the floor, they had to wash their hands. They had to, mask, of course. Last year, we did not put such a emphasis on it. But this year, they are always wearing a mask, always wearing a mask. And they, interestingly, they devised their own ways of keeping a distance, because it was said, keep a distance. So while they were all staying in the ashram as a community, they got these, walking sticks, which we had for everyone over there. They would put a stick between themselves and say, this is 4 feet or this is 5 feet, and one more foot, and it would be a 6 feet distance. So it was interesting, how they devised their own ways to keep themselves safe. They wanted to be safe then. Joe? So as you can see in this photograph, these women have the sticks in their hands. So this is basically how they were keeping distance. We were very amused, actually, at, like, how did they think of it? So our staff said, they themselves came up with it, that we have these sticks and we will use that as, keeping distance within the ashram also. So even during the lockdown, we've had the doctors coming in, our own doctor, and we've been requesting the district doctors also to come in to, check them out from time to time, just for safety. And I'll be very happy to tell you that last year, thrice, there were, the RT-PCRs done of all the women in our ashrams, and not one single woman tested positive in our ashrams, which was like, it was a relief for us, and it was very satisfying. But because we've been on tenterhooks all through, because each little thing kind of makes you feel, hope something doesn't go wrong, because the staff, the food comes from outside. I'll share this with you. So it comes in the containers. The milk comes in containers. The fruits they come in those baskets. So all these are sanitized first before the containers are brought inside the ashram, because we have invested a lot in all these protocols just to make sure that all these women stay safe, because a lot of them have comorbidities, as I mentioned earlier, and we did not want anyone to kind of get even a single kind of a issue. Even a mild cough was a issue for us. Thanks. A little bit down, Joe. Uh, so how did we do all of this? It is, while we all know that this new disease is so new, the world has still not understood, WHO still hasn't understood, nobody has understood what is it and where has it come from. And we constantly share information that we get, and they are actually quite addicted to news, just the way all Indians are. They like to keep themselves updated. They will see all their entertainment programs, like all these Mahabharata and Ramayana and Krishna, etc. But news is followed as diligently by them, and they have questions. Then, even for us, where they have doubts about what they hear and what they should understand from it. So we people have to constantly keep explaining to our staff that, if this is what they're asking, this is what you can say to them. And the expert opinions, sometimes they can be very technical, so they have to be totally broken down and explained to them. And to be very honest, places like this, Vrindavan and Radhakund, etc., Mathura, they are very, very backward places where outside the rules are not followed. We had to go there in the month of August. And when we went there, we found not a single person was wearing a mask. And when we questioned people over there, even the educated, they just said, oh, it doesn't happen over here. And that actually sends a very wrong signal to institution like what we are running, because if people say it doesn't happen, they would get that message. So we had to keep kind of sensitizing them to it, that they can say what they want, but the fact is that you have to be careful. And you can see they always wear a mask now. I think, Joe, we can go next. So, our staff from Delhi has also been going there from the month of July onwards. They get themselves tested before they've been going there. The lady who's sitting, in the chair in the first picture is the lady who's 107 years old. Her daughter also stays in the ashram, and she is 72. And the daughter has a lot of sicknesses. The mother doesn't have a single sickness, actually, which is very interesting. So this is how they've been kind of being taught all the time. We've tried to do, we've tried Zoom workshops also with them, with experts and all. And sometimes it has worked, sometimes the Zoom doesn't work. As I said, it's a backward place, so the internet is not really great. Joe? So as I mentioned, the routine health checkups are done by our own doctor, and the mother's blood pressure and diabetes is being monitored by our staff itself. And it is done, the blood pressure is monitored on a daily basis because they have pretty high blood pressure, despite the fact that we totally reduced the salt since last year. But yet, I guess it has been high. So our own resident, not a residential doctor, but our own Maitri doctor, he goes and he looks at how their medicines have to be monitored. And also the diabetic women, every week their blood sugar is checked out. And in case we find that there is too much of fluctuation, then the doctor has, I mean, as much as he can look at it, he does. But when the things eased last year towards the end, we had started sending them out to the endocrinologists in the hospitals to kind of regulate their medicines, etc. And so this is something we started giving them from last year, May, all the ashwagandha, triphala, basil drops, and they do their chanting. Chanting they do twice a day, yoga, meditation. I mean, we try to engage them as much so that their mental and physical health is, kind of doing good, and emotionally also they're feeling strong. And interestingly, actually, this 1 year, these women, because they've bonded with each other so much, that they are in better health than they used to be earlier. The Reiki was taught in the ashram in 2019 by a lady from Africa, and so they do Reiki every single day. They give Reiki to themselves and to all the others also, and of course they do the meditation as it has been learnt by them through various people who have come to our ashrams. I think we've talked about all of this. And then we've got them carom boards, we've got them ludos, we've got them cards. So they play with all of those. So this is how now they are, all masked up and everything. And carom board, playing with that. This is yoga, the shavasana. So all these things kind of keep them. Then one of them does the Gita part also during the part of the day. Joe, I think we can go forward. They have not missed out on a single. Joe, can we wait for that previous slide, the photographs? This one. Thank you. Thank you. We've not missed out on a single festival or national day. So whether it is Republic Day or Independence Day or Holi or Diwali or anything, they have celebrated each and everything. They have not missed out on a thing. So the little kids that you see over here, so two of our staff members who stayed in the ashram. So these are their two daughters, and these two young girls, they look like children, but they are our staff. They are not so young. They're about 27, 28. So I think we can go forward. Joe. Joe. So, this is a time because we had started doing a lot of travel during this, during our interventions prior to COVID. And that kind of stopped, and it took away a lot from them because they used to enjoy traveling and going to these religious places, not just Hindu religious places. They had gone even to a Sikh religious place, and now they were wanting to go to Ajmer Sharif. They are curious to know, how other religions also function. And unfortunately, all this stopped during this time. And we did understand that, being locked down can also impact you psychologically and emotionally. So this is something that we've had, people come in and talk to them on various issues to help them deal with their emotional or psychological hassles. Like, for instance, we had one lady who really had, she was very agitated and she became violent, and we could not actually help her ourselves because we were not trained to do that. So there is Apna Ghar in Bharatpur. We took her there and we admitted her there, and they were very kind to take her in during the COVID times. And they did a rapid test and took her in over there. But otherwise, it becomes very difficult how to take care of the elderly, because they do get very lonely. And as I said, this has helped them this time, that they bonded with each other, and they kind of started talking to each other far more. Otherwise, they were all, inwards. They would kind of have more arguments than friendly conversations. And I think the bhajans and the kirtans really helped them. And we also invested in buying music system, on which all through the day they have bhakti sangeet going on. They wake up actually to the music of bhakti sangeet. uh, the staff puts it on at quarter to, they like to get up early, so they themselves put it up by about 4:30. Then the staff said they will put it up for them, so the staff started putting it up for them at 4:30, because otherwise the staff used to get up at 5. But then they said, we will put it up for you. So the staff puts that for them in the morning. Joe? So this is basically, again, repetitive probably, but this is how they kind of sit and, have interactions with each other all the time. This is the photograph, with the flowers, where you see uh, Holi. So we got them nearly about 50 tons of flower, sorry, 50 kgs, or no, we got them about 20 tons of flower petals, I think. And they just had a, you know, total festival of playing with flowers, because I think they just enjoy that right now, any kind of activity. And Holi is very special to them. And as you saw, the first slide was the workshop, we were doing behavior change with them. Ways to avoid disease was one of them, which, as you can see. And so this is one of our field workers, talking to the lady about, like, if there were any issues that she had, and how then she can be helped, kind of a thing. Joe? So came the first week of March 2021, and as soon as the government announced that the vaccination was available for the senior citizens, we actually, right from day one, we kind of coordinated with the district magistrate's office, and they agreed that we could take 25 women every single day and get them vaccinated. And all our women and our staff were vaccinated within the first week. And our staff was also vaccinated, kind courtesy of the district authorities, because we requested them that these should be treated as health workers, because if they are not okay, how would they take care of them? And they agreed to it. And so today, I mean, we've got more than 300 women vaccinated, 200 ours and 150 that we work with outside. And after that, anyone else who comes to us and says, please help us get vaccinated, our staff takes them and gets them vaccinated too. Joe? So this is how they went for the vaccinations, They were so excited, actually. I mean, for them, there was no hesitation. Not even one bit, which people may have had. Our, lady 107 and another lady who's 100, they were the first ones. They said, we want to get vaccinated. And, it was very encouraging for us to see that they really did want to. This is when they were all ready to go. So they all dressed up in their fineries, actually, to go take the vaccination. Joe? This is, again, they've gone for the vaccination, waiting for it, or after that. So basically, uh, we've had to create some short-term goals, so that we can react very quickly to meet any issue at hand. Like for instance, if like I said, the lady who had kind of a violent behavior suddenly, we could immediately react to it and called up Apna Ghar, and our staff hired transport, and they traveled 50 kilometers to go and admit her over there. And the same way, we had another three women actually who also had similar kind of issues, but not mental, but physically. They were very, very sick, and we could not take care of them, and the hospitals would not admit them. So when we spoke to Apna Ghar, they were very kind. They said, you can send them and we will take them. So these women were also taken immediately at barely half an hour's notice to Bharatpur, Apna Ghar. Our team is, sometimes I feel our team would be having now issues because they provide so much of care. I mean, we are indebted to our teams because they are doing actually service to them. We are sitting in Delhi, but these are very dedicated people and very compassionate people and very kind people. And they're staying away from their families. We have this young girl who's 22. She has not gone home, much as we keep telling her, you can take leave and go for some time. And she has a sister who lives in Vrindavan. She says, no, I will not go anywhere. Had another lady whose daughter married. And she said, ma'am, I just want leave for 4 hours. I'll go attend the ceremony and come back. And I promise you, my masks will be on and there will be no kind of issue. And I mean, I cannot thank our staff enough, of course. So we've also got oxygen cylinders and oximeters, for any kind of emergency. I hope we never have it, but then one doesn't know, how it goes in future. Joe? Joe? I think we've talked of all of this. We've talked of this. We are washing everything and stuff like that. Actually, now this is something I just saw over here. So when the Prime Minister said, all those, what do you call that, the bells and everything, these women, when they heard it on the TV, they said, we definitely want to do it. To them, it was that we have to be standing with the nation. We have to be standing with the nurses and the doctors. And they did everything that was, being said out on the television, that you do it. They did it, and very enthusiastically. Joe? Joe? So challenges, I think I'll request the general to take that on. Joe, if you can bring that down a little more. Yeah. A little more.
What Winnie mentioned, that these ladies, they come to Radhakund and Vrindavan for praying to Lord Krishna and making sure that they meet their end on the banks of Yamuna. Now, when this lockdown took place, the first thing that hit them was that suddenly they were told you cannot go out to the bhajan ashram or you cannot go out to the parikrima for reasons obvious. It was, I would say, psychological as well as a physical upheaval. And the biggest challenge that we faced was to bring about a behavioral change in their daily routine. It took us some time, and it was, I would say, thanks to the staff that they were able to impress upon them. Some of them even in desperation said, okay, we'll not stay inside if you're not letting us go. So they left. But we said, once you go out, you cannot come in unless you have a proper COVID protocol. So this was the biggest challenge that we faced during this period. Then there was a choice between their safety and whether we permit them to go for certain things like getting a pension or getting their daily necessity. They wanted to go out for any small excuse. It was a very strict regime. I would say I imposed as an army person a martial law and said anyone who goes out doesn't come back. Then
So we got them their daily needs also. We got them their soaps and shampoos and oil, etc. There was nothing that they were wanting in since last year. It every month, everybody's all supplies are given to them by us.
Then when the second this thing toward the end of the year, we started getting requests for more and more ladies who wanted to come inside, because suddenly they realized that it is safer inside than outside. Then we have been very strict not to permit any new admissions till the pandemic is eased out. Then the next biggest challenge is geriatric care. The problems Winnie has explained, psychological issues, physical issues, we have been able to get help from the district authorities as well as train our staff, so that today we can take care of any emergency, COVID related or otherwise. COVID related, we have had none, but we would say that psychologically, as she mentioned, we had a lady suffering from depression, a lady who went berserk. All of them have been taken care of. It was a challenge because Radhakund is all in the wilderness, and if it happens somewhere in the night, you can imagine there is no transportation, how to take the lady to the nearest medical help. It is a very big challenge.
And I would like to mention with this, seeing the challenge that something may happen, we've actually created isolation wards also in our ashram. So in case somebody falls sick, we can move that person over there.
Then maintaining a strict health regime and a diet regime. Now, a health regime in the sense, initially there was resistance to doing yoga or to carry out in the activities which Winnie has just shown you in the photographs. But today the situation is that they come and wake up the nurse and say, put on the music, it's time for yoga, it's time for this. And they are very willingly trying to participate because they realize it is for their good. And this is the only way they can remain healthy. About the diet, somewhere there used to be initial resistance to taking medicine. But two things we have done. One is a flower medicine somebody has given us, which takes care of most of the illnesses and has got no side effect, like acidity and indigestion and other things. Also, the medicines have to be administered to them on a daily basis. A lady who's got blood pressure, she'll be given the tablet, but she'll hide it under the mattress. And we have found as many as 250 tablets under a mattress with a lady. These are the kind of problems which have to be taken care of by staff. So virtually a stage came when it had to be put into their mouth and given a sip of water to gulp it. Literally like children in hostels. Then the excursions and group travel, which has stopped. I think the moment it eases out, we'd like to resume this. It has had a very good effect, all of them. Then our staff, we have to keep them indoors is in itself a big challenge. And there has been a shuffle. There was initially, I would say, disturbance in this wanting to go out. But now it has stabilized. We give them a little incentive also. And the staff on both the ashrams is now settled. I have, being the head of the organization, is on funds. With the corona, the biggest impact has been on funds. Because in lockdown, we used to have walk-in people who used to come and contribute to this thing. They have all stopped. Same way we were getting certain help in forms of rations and other things, that has also virtually come to a trickle. And our projects that were going on, they have also ended up in December. So now we are at a stage when funds is becoming more and more critical because we cannot abandon them at this stage. We have to take care of them. So that is my job now. We are trying to make sure that we can keep the kitchen fire going. And these are some of the problems that we have tried to highlight to you. You can somewhat imagine them also. And finally, I'd like to say that I was very pleasantly this thing that the army has been called out to help out in the pandemic in the country. And we, having instituted all the army strict discipline, have been able to keep our women insulated and in good health.
So this photograph that you see, so the one lady, the one with the, white tika, she is 100 years old. And the other one is 90. And she passed away 3 months back of, just old age. But one of the most loving lady, who went away. So with that, we come to an end. And if you have any questions,
Thank you very much. We'd like to take on any question if you have.
Thank you very much. It is indeed an important experience for our students because they themselves wanted to know how an NGO works and how the services are developed and what services are implemented. And you gave a summary of some of the challenges in taking care of the elderly women. Not only arrange food, shelter, medicine, and also you had to take care of the mental health issues and you had to take care of the service. You had to arrange a human resources for that. So you gave a comprehensive picture about some of the public health challenges and the administrative challenges, some of the personal challenges in organizing services for the elderly women. And in India, this is a significant service you are providing. And I would like to request the audience to ask questions. If you have any special question, either you can ask, you can unmute yourself, you can ask, or you can put the question in the chat box. When others are getting ready, let me ask a question. What motivated you to take up this as one of your mission?
Joe, as a woman, to me, it was, I just felt, I cannot even put it in words what I felt like, to see that how much of poverty these women had when I saw them the first time. And then the kind of humiliation that they were facing and the indignity. And I felt as a mother, she has every right to have dignity in life. She has to be given respect. She cannot be treated like that. And that is what actually was the motivating factor. And I think all of you came together to actually support this thought and take it forward.
And I'd like to share that when we went looking for this project, Dr. Joe Thomas and Dr. Ulf Christopherson were together with us, and they were big motivators as well as prime movers for this project.
Thank you. Any other question from anybody? Mr. Mohan Nair, you have any questions?
Yeah, I want to talk about. Sir, I'm Mohan Nair from Pune. I'm a friend of Dr. Joe. I'm very inspired at your story, and actually, it is something very, very interesting. And also, you have touched the compassionate part of a woman's life at old age. My question is very simple. Most of these women, why do they come to the ashram? Is it because their family has left them, or because they are financially or economically very poor?
To be very honest, they definitely are from the they're from the rural belts, number one, most of them. And two, they're not from even low middle class families, I would say, most of them. Quite a few of them would be from low middle class, some would be from the middle class families. The basic thing that today, what I would say is, earlier there was a reason, they said that when a woman gets widowed, it was a culture in Bengal, they would their head would be shaven and they would be sent to Vrindavan and Varanasi. But for that also, my logic, this is my personal logic, that why that was done was, you shave off a woman's head, you move her out of the house, you throw her out of the house, I would say. You have disinherited her anyway. And when she's disinherited, she definitely cannot protect her own then thereafter. Neither can she protect herself, or she can protect if she has any children. And, basically, it was all, according to me, to do with property. Because if you've disinherited her, she cannot fight for her rights. She cannot fight for her property because it's the custom, and that is what has created all of that. And today, in the modern, in this century now, and in this decade, I can say we have a lot of women coming from North India, from West India, from Central India, and the story is the same. We have a lot of women who have property in their names, and their children have taken over them. And interestingly, daughters have taken over their properties, and they do not want to have their mother even stay in the house. And they ill treat the mother. So this 90-year-old lady who died just now, I really break down at times when, because I was there the day she died, we were visiting 3 months back. She was sick, and all her life she's been heavily into uh, prayers and all of that, and in Krishna. I mean, she could recite the Gita inside out. While we were there, suddenly she went into a kind of a delirious situation, and she started asking for her daughter. So when our staff called up her daughter said, "Please, I do not want to speak with her." So I told her, I said, "Why would you not speak with your mother? I mean, she just wants to speak with you. She's not well." I mean, I didn't think she would die. And she said, "I don't want to speak with her." So the mother kept on saying, "I want to see her." So she said, "Then you can send her." I said, "She's not in a condition to come. Maybe you can come over. We will pay for your ticket, everything. Come and meet her." She said, "No, I'm not." And she disconnected the phone. And this lady died about 20 minutes later. And, she's left a 500 square yards of plot, and which the daughter will inherit now.
FD.
And there is a FD also. Now, that is where the sadness lies, that the children actually do not care. But the minute they get to know there are things, then they come the very next day. They don't even wait. Then COVID, no COVID, the first flight in, even if they can't afford it. So, the thing that we said, that daughters will always treat their parents well, even that is becoming a myth now to me. Because we have so many cases where the daughters are really not taking care of they don't even want to talk to them. They just refuse to talk to them.
Winnie, you have another question from Dr. Deepa Mishra. Dr. Deepa, you wanted to ask that question directly to Winnie or General? You unmute yourself, please ask.
Thank you so much for the answer.
Sir, it's the general. Hello.
Yes, please go ahead.
Hello, ma'am. Hello, sir. It's very it's a very beautiful thing to see that you guys are working so hard. So my question was, during last year, during the lockdown period, we all know that everybody were suffering financially. So how did your institution cope up with the financial problems to meet the daily needs?
Well, it's a question which is not easy to answer. We had some reserves. Then we went around with a begging bowl to all my friends here and abroad and everywhere. And then we did get some support from Oak Foundation. So we did manage to survive. But now we are on the end of the, you can say, the kitty is totally dry.
It's a challenge, actually, so of course our reserves are there. I mean, you know, when you work, you can't work with not keeping the future in mind. So, but this was an unexpected thing, the COVID happening, because otherwise you're constantly always trying to raise funds. But you know, I'm sure we will even pass this test. We will reach somewhere better.
And what General and Winnie may not have told you, actually now they're running it on a general's pension fund. And this is a personal private information. Now you have a question from Priyanka Rachel. Dr. Priyanka, please go ahead and ask the question.
Hello, ma'am and sir. Truly inspiring work. I just wanted to ask, since you know the reasons for why these widows come to that organization, is there some sort of like legal recourse or some organization that would help them to sort of deal with that aspect of it if they really want to?
So Priyanka, the Indian law today actually does provide them with recourse, and the Indian law also protects them, you know, and the children are supposed to take care of them. But the women do not want to. So one of the women who are staying with us, Shakti Dasi is her name. I'm just giving her example. She has a house to her name. It's, you know, it's like a double-story house. She also had a small business when her son actually hit her really bad and burnt her, and she came to Vrindavan because she didn't want to go through any of this. So we spoke to her and we said, look, we will fight the case for you. Let's go and get your house back to you. It's your right. She said, no, I don't want it. So her logic was that the society, what is it going to say if I take my son to court? What is the society going to say if I throw my son out and I move into the house? The society accepts that the son can throw her out, the son can beat the mother, but they will not accept that the mother can throw the son out. Now, this logic, much as I've tried to argue it out with her, to her and to most of them, it is the same. They will not take a legal recourse. They say we would rather we stay here and die as paupers and penniless. Because when I see some of the photographs of some of the widows, they were very well to do in their younger days. They wore lovely clothes and they were good. And today, you know, like their backs are scarred, some of them, their, you know, knees have been hit by their children, broken. So it's very sad. I think they felt so much of pain that they feel, you know, you keep it, we don't want it.
But to add to this, we have a leading lawyer of the High Court Delhi, who is our consultant on the board. And he is very forthcoming for any legal help that we need. But so far, none of these widows have chosen to take the case further.
That's sad. That's really sad.
It's very unfortunate.
Any other question, any comments from anybody? I can take 2 more questions. Okay, thank you very much, General and Winnie. It was extremely kind of you to share your experience. We know that we teach and we learn about public health issues, and particularly elderly care. Elderly care is a challenging endeavor for during the pandemic, and even non during pandemic time, it's a difficult proposition. And raising the money for it, running on a day-to-day basis, and also the standards of care. We don't have any particular standards of care, and national policies much more need to be done for creating a national policy to deal with elderly care. And also the practice of widows going to Vrindavan is extremely culturally ingrained, and dealing with that issue itself is creating difficulties. And also we know that most of the women are coming from West Bengal speaking region. And even though this intensity of this particular social phenomenon is reducing, but still it is part of our socio-cultural realm. And also this challenge is that how do we deal with it, and whatever may be the causes, and how do you deal with the health implications of this particular issue. And this is becoming more important again, let me emphasize in the context of the pandemic. And also we okay. Sorry, we have a visitor from Canada, Dr. Betty Wills. You want to say something, Dr. Betty?
Oh, hi, everybody. Can you hear me?
Yes.
Yeah, go ahead. Dr. Betty is a specialist in geriatric care in Canada. Please go ahead.
Oh, thank you so much for inviting me. I am actually on my way to work this morning, so I'm just going to get ready to go to work. But what I was going to ask you is that I am very quite impressed with what you're doing with the senior elderly women group in India. We are facing pretty much some of the same issue here in Canada. And however, we are dealing with more of like the homeless people in our population. Now, I just have one question. I missed a little bit of your discussion earlier on. With COVID now, do you have any challenges in getting supplies in? Our hearts just break for you. What's happening in India at the moment? I understand how challenging it is to fight COVID, but on top of what's happening in the situation now with the situation in COVID, do you have any other challenges besides what those that you have mentioned already in your presentation?
To be very honest, presently, I think we are just thinking day to day. And these are challenges which are keeping us so preoccupied because, to just ensure that nobody falls sick, they all stay healthy, because we are scared if one person gets it, and this second wave that we have right now, as they say over here, that one person gets it means the whole family gets it. And we would be in, it's like the biggest challenge right now for us to ensure that everybody is safe, because again, there are, I don't know whether the scientific studies are there or not, that it is in the air, but it is said it is in the air. So, it's I would say it's a challenge. Our women are now have the masks on all through the day, and in the night they sleep with it. And I guess it's never easy, you know, uh, uh, to remain safe like that.
Just to quote one of the doctors who had come to do the RT-PCR test, once he had gone through and was very pleasantly surprised that we do not have a single case, what he had to say was, "General, you are sitting on a live bomb with a safety pin out. One case and it will just go like a house of, you can say,
House on fire.
So this is what has now been one of our, I would say,
I mean, this is the thought that just
I
prevails all
hate
the
to
time.
even think about.
Yeah, it's absolutely important that you screen everybody coming in, because I work in a long-term care home, and the home that I worked in actually was the first site that got COVID way back in last March, and we were taken completely by surprise, and we were locked down for about 8 weeks, and we lost 20 residents. And what we've learned now, I was surprised that because we have other nursing homes that came after us, and they lost 25% of the residents. So what we did is very important, is the fact that you screen. If you are still admitting, women into your ashram, what you did, you must be very careful in screening the people coming in. And if you do have to admit them, you have to isolate them for 14 days in an area by themselves, and make sure that they do not exhibit any kind of COVID before you integrate them into the bigger population. The other one we found that is a must to do right now is to wear a mask uh, meticulous hand washing. This virus is actually not spread by the air, in the air, as we were told, is by droplet. It's just like a cold. So droplet, that means when you, before they eat, they have to wash their hands. After they touch, they wash their hands. So we have been, I have been enforcing this with our staff, and even COVID or after COVID, we are going to leave the mask and the hand washing on. So it is important that I am so happy to see that you don't have any new cases or any cases for that matter. So kudos to you all. We have a lot to learn from you because in Canada we all know people are not compliant. They don't want to be isolated. They don't want to listen to the government to stay apart. So we have our new set of challenges. So we do have very good track record with our homeless, possibly equivalent to your population. Is the government start to immunize them rapidly. So what had happened is with immunization, it really cut down some of the risk factors for COVID. So I understand you might have issues of getting vaccine over there and get the mass vaccination program on, and that will be another way that you can continue to fight COVID in the next couple of months. I have one question. I want to know what are the feelings of the women that you looked after. Have you done some interview with them and see, because they honestly lose everything in their life, and you are their new families now. Can you share with us what their experiences have been, and providing support for themselves and give you the fuel to carry on your wonderful mission?
So, did you say that what is it that they think of the last 1 year that they've been there?
Yeah, have you talked to the women who are under your care? What have been their experiences
So
regarding?
we do speak with them very regularly. I mean, the staff talks to them. I've been there 3-4 times since July, and I mean, they are absolutely now content with themselves, because they have come here to stay on permanent basis. They don't intend to go back to their families again. And for them, this is home. And like one of our women, I'll give you an example. She felt that, okay, probably she would like to go out. So she spoke with somebody, and some lady said, you can come and stay in our home. So she left and she went there. She called me up after 2 weeks. She said, ma'am, I've made a mistake. I would like to return. So I said, now, it is not possible, because this was in the month of, I think, August, September sometime. I said, it's not going to be possible because, I mean, we will not be able to take you in. So she said, okay, I will isolate myself. I will get myself tested 3 times in the 15 days, but please take me in. So I asked her, I said, what made you change your mind now? Now, why do you want to come back? So her thing was, she said, I went from here thinking I'll have my freedom outside. But the lady who took me, saying that she would keep me as a family member, she treated me like a servant. And she would not even give me food. So I did not get any respect. I did not get any freedom, and I did not even have a choice to make for myself. And that is something I have found it unacceptable. And I don't want to stay there because it is worse than even staying with my own children. So she moved out, and she was staying in a, kind of a rented kind of a place, which is, I mean, I would say it's in a very pitiable kind of conditions. So we told her, we said, okay, we will put you up in a isolation home, which we trust, and we will get you tested. So we had all of that done, and then she came in, and since then, she's the one. I think she becomes our ambassador. That what kind of good life you get what kind of dignity you have, what kind of good food you are getting, which you do not get anywhere outside, the kind of supplements that you're getting, which you don't get anywhere else. So, those are the kind of things, it kind of comes from each one of them, that they feel grateful. We tell them that they have to feel grateful to God, not to us. But they are grateful that they are staying in a safe place where they are treated with respect and dignity, and they are taken care of.
Thank you, Winnie, and thank you, Dr. Betty, for asking that question. We have last and final question from Dr. Meghna Godake. Dr. Meghna, you want to ask that question? Dr. Meghna, go ahead and ask the question.
Like mental health for senior is a serious concern as it leads to depression, dementia, etc. And it affects the physical health of the elders. So how do you deal with this type of challenges?
We are not skilled in mental health, and that has been it has been brought home to us very strongly during the last 1 year, that how depression or dementia or anxiety, how much trauma it causes in a person. So presently, what we do is this challenge. When we can't deal with it, we are taking the support of this institution called Atnagar. But henceforth, of course, we look at it that we get ourselves, skilled, educated into the field.
There is another question from Dr. Deepa Mishra. Deepa, you want to ask that question?
Yes, sir. So, ma'am, can we have an opportunity to have an internship at your institute?
Absolutely, Deepa, we would welcome that. It would be wonderful, for us. If you come there, you would be able to actually give us a lot of insights about our working also.
Yes, ma'am. So, ma'am, when the situation get
Absolutely.
we can wait for the situation to get better. After that, we will come and join your institute, because even I stayed at Delhi,
Absolutely.
so it will be very close for
Wonderful.
me to come.
We would love that. We look forward to it.
Thank you.
Thank you so much.
Winnie and General, that is an offer. I mean, I'm so grateful that you're willing to take our students as the interns. And I was meaning to ask that anyway, students, they ask themselves. And thanks for the offer. We'll definitely take it up and we'll come back to you. And let me thank again Winnie Singh and General Bhupendra Singh. It's a great lecture indeed, and you spoke from your own experience and you spoke from your heart, and you shared your day-to-day experience of running an elderly home for the widows in Vrindavan. And widows in Vrindavan is a very significant social phenomena in the Indian psyche and Indian social context. And your services is much appreciated by everybody, and it was a great learning experience for all of us. And we look forward to working with you in future as well. Thank you very much, and have a good night. And thanks to the MIT World Peace University School of Public Health and the Faculty of Sustainable Studies for allowing me to host this. And also let me thank Professor Limai sir, who is the Dean of our faculty. So let me thank again to all the MIT World Peace University staff and the officials for allowing me to organize this. Thank you very much. And thanks again to all the participants. Have a good night. Bye-bye.
Thank you. Good night.
Thank you very much.
Sir. Thank you, sir.
Thank you. Thank you.
Thank you.
Thank you, sir.
Thank you, ma'am.